What is major or chronic depression? Most people feel sad or low at some point in their lives, but critical depression is marked by a depression mood most of the day, sometimes partially in the morning, and loss of interest in normal activities and relationships. Symptoms that are present every day for at least 2 weeks. In addition, according to the DSM-5, a manual used to diagnose mental health conditions, you may have other symptoms with major depression. These symptoms may include fatigue or loss of energy almost every day, feeling of worthlessness or guilt almost every day, impaired concentration, insomnia or hypersomnia, which is excessive sleeping almost every day, no interest or pleasure in almost all activities nearly every day, restlessness or feeling slowed down, recurring thoughts of death or suicide, significant weight loss or gain, which is a change of more than 5% of body weight in a month. Who is at risk for major depression? Major depression affects about 6.7% of the U.S. population over the age of 18. According to the National Institute of Mental Health, overall between 20 and 25% of adults may suffer an episode of major depression at some point during their lifetime. Major depression also affects older adults, teens, and children, but frequently goes undiagnosed and untreated in these populations. What triggers major depression? Some common triggers or causes of major depression include loss of a loved one through death, divorce, or separation, social isolation or the feeling of being deprived, major life changes, moving, graduating, job change, retirement, etc. Personal conflicts and relationships either with a significant other or a spouse or superior, physical, sexual, or emotional abuse. How is major depression diagnosed? A health physician, such as your doctor or psychiatrist, will perform a thorough medical exam. You might receive a screening for depression at a regular doctor's visit. The professional doctor will ask you about your personal and family psychological history and ask you questions that screen for the symptoms of major depression. There is no blood test, x-ray, or other laboratory test that can be used to diagnose major depression. However, your doctor may run blood tests to help detect any other medical problems that have symptoms similar to these. For example, alcohol or drug abuse, or some medications and stroke. How is major depression treated? Major or critical depression is serious but treatable illness, depending on the severity of symptoms. Your primary doctor or psychiatrist may recommend treatment with an antidepressant medication. He or she may also suggest counseling or talk therapy in which you address your emotional state. Some other medications are added to the antidepressant to boost its effectiveness. Certain medications work better. For some people, it may be necessary for your doctor to try different drugs at different doses to determine what medication works best for you. There are other treatment options for critical depression, such as ECT or shock therapy. This can be used if the drug treatment is ineffective or symptoms are severe. Can major depression be prevented? Once you've had an episode of major depression, you are at high risk of having another. The best way to prevent another episode of depression is to be aware of the triggers or causes of major depression and to continue taking your medication to avoid relapse. It is also important to know what the symptoms of major depression are and to talk with your doctor early if you are having any of these symptoms. These symptoms include fatigue or loss of energy almost every day, feeling of worthlessness or guilt almost every day, impaired concentration, insomnia or hypersomnia, not interested or pleasure in almost all activities nearly every day, restlessness or feeling slowed down, recurring thoughts of death or suicide, significant weight loss or gain, a change of more than 5% of the body weight in a month. These are brought by loss of loved one through death, divorce, or separation, social isolation, or feeling of being deprived, major life changes, moving, graduation, job change, retirement, personal conflict in relationships, either with a significant other or a supervisor, and also physical, sexual, or emotional abuse. This has been major depression.